Hi, my name's Noel McDermott. This is the Wellbeing Show, and I've got a returnee guest, Mike Delaney, who's it's really good to have him back, and part of this new setup that we have for the Wellbeing Show, where I do a pre-record. So you're seeing this on a Wednesday evening, but don't call me. It's not live, so I'm not taking calls. But do get in touch with us. And if you've got, you can email us or message us and let us know what you think of the show, topics that we should be covering, and any feedback on this one would be welcome. And any questions, I'll pass them on to Mike when I get them. I'm sure I'll be happy to field them. Mike's an author, ex-CPN, which is the community psychiatric nurse, and a current psychotherapist or counsellor. I'm not quite sure which word people use these days, maybe both, but I'll find out. And somebody who's been involved in mental health services for many years, and we were just catching up on some stories before I started recording, so I might let you in on some of those. Anyway, welcome back, Mike. It's great to have you back with us. How are you doing?
Thanks, Noel. Thanks, and thanks for inviting me back. Yeah, I'm good.
Yeah.
Busy time, I'm afraid, but there's lots happening. Yeah, but I'm glad to be here.
Great. So what do you call yourself, psychotherapist or counsellor? I don't know.
I'm counsellor general. Psychotherapy, I talk about with horses because it's a branch that we do specifically with horses. But generally, I'm an addictions therapist counsellor. Yeah.
Okay. Well, I'll call you whatever you want to. There's a lot of these terms around. Shall we just talk about those terms a little bit? Because I think it gets confusing, and this whole thing about regulation versus all of that stuff, because you're were in both camps. So you're still a CPN, and you still got your PIN.
No, I just let my PIN number go last year. I had actually let it go, and then COVID happened, and the NMC asked nurses if they would come back. So I re-registered for a couple of years, but I didn't need to do anything really. The services around me were okay. So I've just let it go again last year, but I held that for 40 years. And this year is my 47th year in mental health.
Is it?
Really? Yeah.
Well done.
There should be sections, really.
I'm sure some of your colleagues have thought that at times.
Yeah,
maybe even tried to get it done behind your back, given the gallows humour on some of the wards.
Yeah, absolutely. Yeah.
But I mean, what did you start as a CPN? Just so that people know, a CPN is a community psychiatric nurse. So
yeah,
mental health nurse with a specialism in the community.
Yeah. So I started in the hospital system up here in Scotland in a place called Larbert. So I trained as a nurse, which was a 3-year training. I qualified in 81. So I worked as a staff nurse, and then I moved to England and got a charge nurse's position in a large hospital. At that time, they were beginning to think about closing them down, but it was a few years before they got there. So when it eventually happened, I was one step ahead and became a community psychiatric nurse, so that I would know. I helped to close down one of the hospitals and move everybody out, and then I worked within that community. But then within families,
I worked on a few hospital closures, more in dual diagnosis, so learning disabilities, mental health.
Yeah, I did some of that as well.
Yeah. So, I mean, I worked on one that you know of, which was Gogarburn Hospital up in Edinburgh, and that was a famous closure program, and another one down here in England called South Ockenden, which was
South Ockenden. Yeah.
It was it was its own city, actually.
I remember there was an inquiry into South Ockenden many years ago, wasn't there?
Right.
Because of
I remember that. That's right. And so worked on returning people to Newham, not returning them. They'd never really been there. So
yeah. I was the same. I was in Waltham Forest, and I had an office in Leytonstone House Hospital, and most of those people came from Surrey and all places. There was hardly anybody from the local area.
Yeah.
So the relocation was difficult.
I mean, what do you think looking back on it? So, because it was initially resisted, I remember, particularly because it was brought in by Maggie Thatcher, and sort of people just said it was a political money saving thing. I'm a great fan of care in the community in terms of outcomes. I think the outcomes are better. But what's your sort of experience?
I think, yeah, I agree with you. I think they should never have happened in the first place, but they did.
Yeah.
And I think sometimes in some places I was close to, there wasn't enough thought went into them moving out. There wasn't enough planning into what they would need when they were out. So we've ended up now with a complete lack of emergency services as such, kind of respite services. Because one of the things that often happens when I've been called to people is they need an intervention. They need to go somewhere to be removed and to be looked after and cared for. And I think that's what we've lost, the kind of a safe space. When I was in the hospitals working, we knew the clients, we knew the ones that were at home. They would just phone up and say, I think I'm having a breakdown, can I come in for a few days? And that was enough. They would come in and stay maybe a week. They would get their meds reviewed or whatever, and then they could go back out. So I think I think it's right that they're all out, but I think we should have created some services ready for them going out, because I think a lot of the people that would be in these services are now in prison, and there's the prison population has been swollen by mental health beds.
I see if I can find it and share it with you, even during this chat. But I saw an interesting graphic on the US, and it had two graphs. One was hospital or institutional care for people with mental health issues that went like that from the 1930s to now. And it went prison population, went the other way, prison population. And, you know, there's a strong argument that something similar is happening in the UK, particularly when it comes to men, because men and mental health are now prototypically will end up in the criminal justice system. And even, you know, and I'm talking about people, I have to be careful about this. I'm talking about people I'm currently working with. I'm not going to identify them in any way, but they with multiple and complex needs, often criminal justice system does get involved because of the risk profile in the community. And, you know, the use of the things like the comorbidity around substance misuse, for example, which is very so 40% of people with a psychotic illness will be comorbid with quite significant substance misuse issues. And because of our obsession with trying to police substance misuse, we end up with a situation where the police get involved in situations that are exclusively health issues.
Absolutely.
Because people are using these substance misuse issues are very much integrally part. I don't need to tell you this, but for the people listening, it's an integral part of the illness. It's absolutely embedded within the illness, and has nothing to do with criminality as such. I mean, I don't know. I mean, because you're Scottish, I mean, there tends to be some more enlightened thinking in Scotland. And one of the ministers in Scotland recently talked about decriminalising substance misuse, which, to be honest, I think is long overdue.
Me too.
I think it needs to go that way. They've done it in Portugal massively successfully and really turned things around there in terms of substance misuse. So what's your feeling on those things?
Absolutely agree. I've been back home in Scotland now 5 years, and one of the reasons that I came home is the increased drug deaths, the kind of lack of. It felt like nothing was happening and everybody was dying, and that's true to a degree. The MP you're talking about wants safe consumption rooms, all this kind of stuff. Westminster's blocked it for the word go because we still come under the Substance Misuse Act, and they're not going to change that at this point. There's still a war on drugs in Westminster, if you like. Whereas there is
they just still need their scapegoats, don't they, for incompetent policies? And so drug users are just another one like asylum seekers, whatever, you know.
Exactly.
Nonsense, isn't it? But from a professional perspective, what do you think we would gain in terms of taking that route?
I think it would take everything above board, take everything into the light, and we would actually be able to see what we're dealing with. I think it would cut out the black market because there would be no demand, because it would be freely available for those who needed it. I think it would need to have safeguards. I went to a Scottish Government thing and they had a a lady from Norway, and Norway had the highest drug death rates a few years ago.
Wow.
And this woman was a lawyer, but so many people were dying. She said, "I'm going to try something." So she bought an ambulance that was out of service. She went to the police and said, "If I go to a certain square mile within the drug using community, will you stay out of it? Will you allow me to try this and stay out of it?" And they agreed. So there was a square mile that was a no-go area for police. And she went in with the ambulance with clean needles, with clean heroin, morphine, all that kind of stuff.
Yeah.
And overnight in Norway, the drug death rate stopped. None at all.
Wow.
Just by that intervention. That sold it for me. I went, well, that says everything. You know what I mean? You're not having to deal with all the abscesses, hep C, all this kind of the
Exactly.
constant medical problems that you're having.
And also the muggings and the thefts
Oh
that
my
people
God,
need to, because
yeah.
if you add poverty into substance misuse, that's when you get a huge problem for the society.
Yeah,
The
absolutely.
substance misuse, when it's illegal, is a huge problem for the user because of, as you say, the health issues that come,
Yeah.
and because the issues around criminality and hidden stuff.
Yeah.
But for society, all of the problems come from the poverty element.
Yeah, yeah. I went to a conference again, same time in Edinburgh, and there was an American professor, a New York black guy with big dreadlocks. I can't remember his name off the top of my head. But he stood up on the platform, and there was all these addiction professionals, and he said, "I like heroin. I take heroin. I take it. Maybe at the weekend. Doesn't interfere with my work." He said, "Because I'm not an addict." He said, "And I feel that you lot try and control my life because you are addicts. But actually you're a small part of the people who use drugs." And it really kind of I went, oh my God, I've never actually sat and listened to this perspective before. And he actually stood, his words were, "It's not a war on drugs, it's a war on the poor. We don't send police trucks into big rich areas. They don't go into the Hamptons and raid houses. They go into the Bronx and London. They don't go into Kensington and Chelsea. No, it's Brixton and all the kind of council estates that get raided." So I really kind of rethought my idea on everything from that guy's speech, because it was so refreshing to hear that other attitude and to see, because I'm in recovery, that's in my head quite a lot, to hear another aspect of that actually I'm in the minority. Do you know what I mean? It's my problem that I've got an addiction. It's not his problem. So why should his life be?
I was literally talking to somebody else on their podcast about it this morning.
Right.
Somebody else called Sam, but his second name is Delaney. So another Delaney, but he's Sam and you're Mike.
Right.
So I was like, oh, I've got a lot of Delaneys today. But we were just talking about his in recovery as well. I'm just talking about, the number of people that need abstinence-based work, which is what you're talking about, recovery, is maybe 10 to 12% of the number of people who have substance misuse issues.
Yeah.
So the other 80 to 90% of people just don't need that type of thinking and approach, which is essentially what you're saying, isn't it?
Yeah.
And then if we look at, and I'm a big fan, to be honest, of harm reduction approaches, which is, the general topic that we're talking about. So coming to that in terms of street level services, I remember being because I started my clinical practice up in Edinburgh, actually, at the Royal Edinburgh Hospital and the Gogarburn hospitals. But they used to be down, I'm trying to remember the name of that street down the bottom of Greyfriars Street. The tourist trap area.
Yeah, I know we are in the old town.
Yeah, but there was, I forget what it's called, the market area.
Yeah.
And there used to be a harm reduction service there run by the Lothian Primary Care, which was
right.
And it was just people off the streets would come in, people who lived on the streets. And it dealt with everything, So it was people who lived were homeless, street homeless, who would come in. No judgment, nothing at all. And you would get a new set of clothes, you would get a shower, you would get a shave, you would get medical treatment for your abscesses and wounds. You'd be given clean works, needles, and clean medication, etc., etc. And that It was a real haven, and local people really welcomed it. And one of the arguments in Westminster, sort of, I can barely say that word without spitting.
Don't.
Sort of one of the arguments in Westminster is that local people don't want these types of services on their doorstep. My experience is exactly the opposite.
Me too. Me too.
Because what happens is it stops all the problems.
Yeah.
So you're not getting harassed by people off their heads. You're not getting people just lying around. You're not getting
they're clean. They're
that's
right.
Fed.
I was involved.
And you don't even notice the people anymore because they are, they're getting basic levels of care, so they integrate in much more, and they're not engaged in antisocial criminality as well.
Absolutely. I was a trustee for a little while of a charity in Birmingham. It was called HARP, and then it changed to something. But it was exactly as you say. It was a drop-in for people with alcohol problems. There was a chiropodist there. There was a nurse there. There was showers. There was clothes. All that kind of stuff. And I remember I spent a day in just with the guys that were coming in and out. And at one point, I heard a noise, and there was a young girl on the desk, only about 18, on the kind of reception part. And this guy banged the desk and started shouting and swearing. And it was the first time I stood up to go and help. And this girl just went, "You're making it really difficult for me to support you." And just that one little phrase, I went, "Oh my God, she knows what she's doing." And I sat back down again. And this big giant went, "I'm sorry," and started telling her what was wrong. But he was so used to getting the confrontational approach. And that's exactly what you're saying. There was a steady stream of people coming in and out of that, and nobody else bothered. You know what I mean? Because it kept the place clean, it kept the place free from all these drunk people, and some of them even had wet houses that they went to that was supported accommodation for when you were still drinking, and they had rules and they had staff. So it's that kind of meeting people where they are and working with them where they are until they're ready to move to the next phase. If they do want to move to the next phase, some of them don't. Some of them that I've met and I've heard the trauma, and I've thought, "Oh my God, if I was you, I wouldn't want to get sober either." Because you're carrying that much pain. It's like, "Oh my God, how have you got here?" By this, what's happened to you? Do you know what I mean? It's shocking.
Yeah, but I guess that's the bit people don't hear, right? Is that, and that's what you would hear as a mental health professional. And listening to that stuff, I mean, it must have had its impact on you over the years, Mike. It must have some of that has gone in, I guess.
I think so. I think for the first 20 years of my career, I was descending into active addiction. So I was hearing that stuff and absorbing it, you know what I mean? And there wasn't supervision back then. There wasn't kind of support groups or anything like that. People went to the pubs and met. So I would meet social workers and other nurses in the pubs, and we would talk about what had happened that day. Because some of it was, there wasn't so much structure then. I was a CP, and I remember getting sent to someone's house, a new referral, go and take an assessment, and I knocked on this door in Leytonstone, and this guy opened the door and went, "Yeah, come in." It was him I was there to see. And as I walked in, he closed the door behind me, had a big knife in his hand. And he said, he went, "Living room," and pointed. I was like, "Oh, shit." And this was a blind referral because we didn't have lone working policies yet. Didn't have all that stuff to keep you safe. Eventually, I got him talked down, and he gave me the knife, and he had his mum. It was his mum that had phoned in the morning. She was nailed into the bedroom. He had nailed big 6-inch nails through the frame to get them out. And then I got him to come voluntarily, but we got him sectioned because he was deluded and dangerous. And while I was bringing him down, I remember him sitting in front of me talking, but he was digging up the carpet when he was talking. And by the time he was finished, it was splints of wood that were coming up out the floorboards while he was talking.
But we do those things.
We do those things, yeah.
And we manage them, and they have an impact. So you were saying that during that time, your addiction was beginning to take hold. So do you mind talking about those years, your addiction, where you think it comes from, what it was all about? I mean, it might surprise people because we think of addiction as, people on the streets, on the park bench, etc., not as highly educated, highly skilled mental health professionals such as yourself who are holding down a job, etc. But actually, that's the norm, and that's the majority of people who are struggling with substance misuse issues are just living their life, right?
Yeah.
And for some people, like yourself, it progressively gets worse until you have to do some emergency work.
Yeah.
But actually, for a lot of people, they will go through most of their life in this sort of miserable state of substance misuse, right?
Yeah.
So do you mind talking a little bit about your experience and sort of...
No, I mean, there's a cultural thing, obviously, Scotland, so there was a cultural thing about alcohol.
Yeah.
And the kind of goal when you were growing up was to be old enough to drink. So it was that kind of, that's what you aspired to. But unbeknown, it wasn't until I did rehab and then lots of therapy that I looked back with a different set of eyes and went, oh my God, the trauma, oh my God, this happened, that happened. Because when you're surrounded by it, you don't know that it's trauma. You don't know that it's
It's
terrible,
just normal. It's just life.
all your friends are going through the same thing. I was born 15 years after the war. There was lots of poverty. I was in central Scotland in a sectarian area, so there was lots of aggression and violence. Even within my home, there was 10 years in a 3-bedroom flat.
Yeah.
So there was a lot of anger and stuff. I was kind of sensitive. All the kids, I was sensitive. So I remember absorbing stuff and no saying it and no getting into the conflict that everybody else was getting into, and feeling the things that my family didn't feel. So hence I went, and not, again, hindsight, 16 I became a nurse, helping other people. So it was kind of physician, heal thyself, as I say. But I started getting all my needs met through looking after other people, and that stops me looking at how I felt about me and how I really was. And then there was a sexuality thing in the 1970s in Scotland. It was nigh on impossible to come out in the place where I lived. So then you were living that kind of double life. I had a daughter in Scotland at the same time I knew I was gay, and I was struggling with that conflict. There was so many things like that. And even now we understand intergenerational trauma. Do you know what I mean? I'm 3rd generation Irish that came through all that trauma to end up where we ended up living. So there's a whole load of stuff that's constantly causing all this. When I actually got into rehab and stopped and kind of detox, I went, oh my God. And I remember the weeks and weeks of tears and anger and shame and rage and all this stuff that come up, because trauma makes you behave in ways to keep yourself safe. So you inadvertently hurt lots of people while you're doing it. You get into all these things. My nursing career was it was successful, because I knew when I was going to get into trouble and I would leave. I would go, I'm going to get sacked here if I don't pull myself together. So then I would resign and go somewhere else, start again, and it took a while for it to catch up. I describe it as like an invisible line, and for years I was able to see the line and then go like that and pull myself back and go, right, get your act together. And then at one point I crossed the line and I couldn't find my way back, and that was the end of it. You know what I mean? It was a final suicidal, maniacal week of madness that I just said, I can't do this anymore. And the thing that also didn't help was the fact I was a professional, as you say. When I put my hands up, and I was working for a social services department at the time who had a clear policy for drug and alcohol addiction, when I put my hand up and owned it, which took all the courage I had in my body, they said no, that because it had never affected my work, they wouldn't fund it. So they kind of just...
What?
Yeah, they said, we've not got the budget. And I was in a detox unit with my wrist bandage where I had tried to kill myself.
It's quite...
Yeah, so I was going, well, if I killed somebody, you would have funded it. Do you know what I mean? If I had gave the wrong drugs or... And they said, yeah, basically, yeah. So my faith was lost then in my employers.
That's
but it's that kind of
response really on their part.
The shame attached to it, even by your colleagues. Do you know what I mean? In many ways, makes you keep it a secret, so it gets worse.
But it is. I mean, it is. There's There is research that shows that not only do mental health professionals have a higher incidence of substance misuse issues, but there's a greater resistance to
Yeah,
seeking help
yeah,
because there are, complex intellectual defenses, but
yeah,
also
absolutely.
people hiding stuff. So you can sort of
Yeah,
run rings around people because you know the lingo,
yeah,
but also if we think about not just mental health but health professionals in general, the figures are quite worrying in
yeah.
terms.
Yeah, they are. I
Yeah,
spent a few years working with, there was a service just for doctors and dentists
yeah.
because they couldn't engage fully with treatment and because it's so intellectualized. And you had to specifically work at bringing them out of here and bringing them down into the body because there was a disconnect, that kind of the intellectualization of everything. Um, Another way of coping because doctors have to do a lot of difficult things and give a lot of horrible information to people, and then they kind of have to pretend it's okay.
But it's also, I think, particularly, in the health services, people, as you say, professionals dealing with really highly stressful things a lot of the
Yeah,
time.
yeah,
And even if you don't come from a background where you have insecure attachments and trauma and all that sort of stuff, it can wear you down, I think. And
yeah,
particularly, we think about during the pandemic and what happened to health professionals and social care professionals during that time,
yeah,
the sort of incidence of PTS type symptoms
yeah,
really got significant, I think. But
yeah,
it's a reality for health and social care professionals in general that because you're exposed to other people's stuff.
yeah.
Coming back to that conversation, sort of what's your experience in terms of, they call it secondary trauma, which it's almost like it makes it seem it's less severe. It's not
No, no, it's
at all.
not. It's not. And I met many nurses after I was doing some equine work, and a lot of nurses came to this kind of taster day, and they were all traumatized. I mean, I was talking to them, and they were breaking down, and I was like, "Oh my God, they're still having to work because nothing stopped. The pandemic's lessened, but their workload hasn't.
Yeah.
So they've not had time off. They've not had a decent break. They're still kind of covering firefighting, and they're absolutely traumatized. It's shocking that
And
they're
also, I
being
think the basic trauma management systems are not in place.
yeah, yeah,
So we know what works, and it's just about decompressing. It's about sharing at the end of shift. Very simple stuff
yeah,
will reduce the risk of trauma significantly, but it's not doing. It's not happening. It does
no,
happen. I think it is almost certainly the case. I haven't worked in hospitals in a long time, but I think it's almost certainly the case that the way people manage it is still down the pub after
yeah.
the shift.
It is, it is.
The
And I can
majority,
understand why, because
yeah,
when I was a nurse at the end of the shift, I wanted to laugh. I wanted to bring some joy back in because it was tough. That working in acute mental health and learning disabilities is tough. At the end of some days, you're like, oh my God, I need to leave this job
yeah.
because this is going to kill me. But then you go back, you kind of there's a bit of you goes, yeah, but I can do it, and yeah, but they like me, and yeah, I'm getting somewhere. So you talk yourself back into it.
Yeah. And I think, highly motivated health professionals don't like to think that they're going to fail.
Yeah, yeah,
It's really interesting. There's in most industries talk about absenteeism as a problem, but in health industries, in health services,
yeah,
it's the opposite is true. They call it presenteeism,
yeah, yeah,
being too present and not acknowledging that you
yeah,
need time, that you are
yeah,
ill, that you need time, you need some help, etc. And you
yeah,
present yourself for work because you're highly motivated.
yeah,
And that's a significant problem, I think, in
yeah.
health services
You
still.
stay over your hours. You don't
Yeah,
get paid for it. Coming in your days off, all that. You eventually burn out completely and
yeah,
fry.
yeah,
I
absolutely.
think that touches what you're saying about full blown addiction and harm reduction because I think since I've been working in private practice for the past 10, 15 years, I've worked with a lot of people who came to me presenting as I'm an alcoholic. And once you look at what's underneath and do some work, I'm quite happy for them to go and try having a drink again, because you're past
Yeah,
that traumatic period that was making you drink too much. Do you know what I mean?
yeah,
I've lost the old kind of mantra that once you're an alcoholic, you're always an alcoholic. I've seen too often people who don't need it once to feel okay.
yeah,
It's that it
yeah,
sedates them temporarily.
yeah, yeah. That's an interesting perspective. I guess you don't talk about that in 12-step meetings too much.
Not too often, no. And do you know, funny, when I first moved home, I had a 15-year-old boy, and he got referred to me because he had tried to kill himself several times, or he
Yeah,
almost died several times with Valium. And the CAMs couldn't see him for 18 months. It was
yeah,
crazy. So the mother phoned me and said, will you see a 15-year-old? And I was like, I went, okay, bring him. So we did this, worked together, lovely boy, turned up every week with his mum. And I said to her, right, he's 15, he's coming up 16. You're never going to make him stay abstinent. It's never going to happen.
yeah,
We
exactly.
need to be able to introduce alcohol into this equation and allow him to do it, because he's got to go through that phase. And we heard this and he was like, okay. And we made a plan together, and we made plans about what to do if he was going to have a drink at the weekend, and what to eat, and how to dilute non-alcoholic drinks in between. And his mum phoned me a couple of weeks later and said he came in on Friday night tipsy, and I was delighted. You know what I mean? It's his first time that I've been quite happy for him to go out and come back. And
Right.
now he came into my office a couple of weeks ago. He's at university. He's passed his driving test.
Nice.
He's this, and no got any problem at all with
Great.
anything. Do you know what I mean? So it's that, forget the labels. Let's work with what we're dealing with here. Let's
Yeah.
get through this and see how the land lies
Yeah, and
before.
I'm a great fan of that approach. I think we need to tailor things to the person in front of us,
Yeah,
and also within our own competencies and experience as well.
yeah,
I mean, I worry to some extent, and let's have a bit of a chat about this, but I worry in addiction services the dumbing down of the work that's happened over a significant period of time now. Baroness Black, if you remember her report, which came out just prior to the pandemic.
yeah,
She was looking at it, and the rise of unqualified sort of sober coach type stuff,
yeah,
which has really dumbed down the area. I'm not saying any of those individual coaches are dumb, but they're not qualified, and they're not clinicians, and they're doing highly complex work in unsupervised, unstructured settings, and charging a lot of money actually.
yeah,
You can be charging up to £500 an hour just to sort of be sitting with somebody when they go to the cinema, for example.
yeah, yeah, yeah,
Just quite extraordinary stuff.
yeah.
Um, but they have limited, and then you have people who get sober and then immediately train as addiction professionals with
Yeah.
nothing else. And so these types of things are, a little bit concerning to me
No,
because,
I agree, and I think
and
it's
I'm
got
not throwing
worse.
stones. I'm like you. I was already qualified when I got into recovery.
Yeah,
So that was my route in, as a health professional who had a substance misuse
yeah.
disorder, right? So in that field, what's your sort of thoughts and feelings about it?
I agree. I got into a lot of trouble because I said something that was put into, I think it was the Times. I said something in an interview, and it got spread everywhere. And I wasn't saying services today are awful. I was saying services today have been decimated. So when the credit crunch happened in 2008, 2010, they closed everything.
Hmm.
So services that were run by experienced doctors, psychiatrists, therapists, experienced drug workers
Yeah,
were closed. They were closed outright. They were tendered out to charitable organisations.
yeah,
The first thing they did is sack everybody and bring in unqualified workers who didn't know anything. They sacked the doctors and then made the clients go to the surgery that doctor was based. So all that happened was the waiting room became full of addicts waiting on methadone script. You know what I mean? It was really badly done all over the place. Some of them have survived, and some of them do. So I'm a great believer in organisations. Even the bad ones have great people in them.
yeah,
And I think there's some amazing people out there, but there's also some people out there. I think when someone gets into recovery and goes straight to work, it's very dangerous because there's no enough awareness yet about themselves and how this works to be working with people.
Yeah.
So it becomes, you need to do this because it worked for me. You need to do this. You need to go here. And the person ends up kind of browbeaten into following a path that might not be right for them.
Yeah.
And there's no enough, even something as basic as listening skills, actually hearing what someone's saying to you in a session, rather than hearing the first few words and going, no, you need to do this, and going straight into teaching, you know what I mean, and kind of cajoling. So I agree with you. I think the services leave a lot to be desired. They're talking up here about opening a residential in Edinburgh, funded by the government and charity. So we'll see what happens with that. I'm going to keep my eye open. And some of the Broadway lodges are still here. Delamere's doing really, really well, and that's 3 years now it's been going. Getting really good longer term outcomes, and that comes from a different model. Stop, start, grow, nothing to do with God. And it's working, and the evidence is showing that it's working. So
I mean, talking about models, I'm in despair of the preponderance of Minnesota model practice, which I think is a disaster, an absolute disaster. And it works for some people, that's fine. But like I say, 10 to 12% of the substance misuse population might find sort of abstinence-based work useful, as you say, for a period of time anyway.
Yeah.
It may just be part of their career, and certainly gets more complicated with opiate usage, because the evidence is quite clear that medically assisted recovery is absolutely essential within opiate sort of recovery. So being on a script for the rest of your life is probably where most people are going to be, and that's fine. And that's absolutely fine, because it reduces all sorts of harms, and allows people to function, etc., be part of society and get on with things. There was this obsession for a while with this sort of very hard-nosed Minnesota model imported from America, which was inappropriate, really. And
it's still fairly common. It's still probably the most prolific among all the rehabs. Some of them have kind of moved forward with it therapeutically and brought in other things to support it, which is easier. It's nicer. And Delamere, if someone requests that, we'll work with that. So if you come in and, for example, some people have been in long-term 12-step recovery and relapse, so they've come in and we've just given them everything they need to go back into where they were. Do you know what I mean? But most people come in with the thought of, I want to learn about myself. I want to understand this better so that I can go outside and make more sensible choices. I don't need to feel trapped in a given situation. And most of them choose abstinence, funnily enough. Once they get through it, they actually go, I think I need to stop.
I mean, the reality is there's very little reason to drink. Like there's very little reason to use heroin in reality. So when you start to make rational choices about it, you can see that the health consequences are pretty poor. And so why would you bother if you get into a healthy lifestyle? Which is interesting, because like since 2015, for example, there's been a public health campaign around young people and smoking and drinking, and rates have dropped off significantly since. And abstinence, it's not an unusual word. If you say to people, if somebody says, I don't smoke, what they're saying is, I'm abstinent from tobacco. That's not an unusual statement to make. And we understand that as a health conscious decision. And my prediction is in 20 years' time, we'll be saying similar things about alcohol, because alcohol is, from a health perspective, is an absolute disaster. There's nothing else about it. In Ireland, they managed to get some legislation passed so that they're going to be putting cancer warnings on alcohol. And similar to cigarettes. Isn't that interesting? And I think that's where this is all going, and I think fair enough. But I do think the debate has been hijacked by people like you and me obsessively talking about recovery. We need to shut up about it and talk about broader issues around what's going on in terms of what people are doing, to be honest. But for you, abstinence recovery worked, and it opened up a doorway for you into a better life, I guess.
And it introduced me to other things. So rather than just, and I know a lot of people who, and they've got the recovery and they go to 3 meetings a week and this, they've got the routine. That was never going to do me long term. That was kind of my bridge. And the AA Big Book says that, a bridge to normal living. So
Yeah.
I used that for as long as I needed to use it. I still occasionally going out to a meeting or go to a convention. But I like to get on with my life and try different experiences and go into therapy when I need to and come out of therapy when I don't. Kind of, I think discovering yourself and discovering the world around you is much more exciting than totally focusing. I don't want to drink. I don't want to drink. That kind of, that wouldn't be recovery for me. Do you know what I mean? I've
Yeah.
sat in some meetings and thought, oh my God, if I was you, I would drink,
Yeah.
because they're
Yeah.
so
Yeah. Yeah. Yeah.
unhappy and
Absolutely.
angry.
Absolutely.
Do you know what I mean?
Yeah.
Um,
Yeah. 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 The angry, controlling brigade.
yeah, yeah, yeah,
But I swerve them.
yeah. Me
But
too.
to be
Yeah,
honest, I've been there as well. I have to say,
yeah,
I've been an angry man,
yeah,
and so I'm not throwing stones. So sort of recognize where it's coming from. I just don't want it in my life anymore. That's all.
yeah. No, exactly.
And that's the way it is. And I think that's the point. And there's something about the groups that people, when people are reintegrating into society in the early days of going from a very isolated, self-obsessed, self-absorbed experience of
Yeah,
life, involving that shame and the hiding, and then joining groups is really helpful.
fabulous. That's fabulous. I mean, the actual components of it and how it should work is amazing, and it did for me. But it worked because I put the effort in. So I did sometimes 2 meetings a day. I was the chair at one. I was secretary at another. I was terrified to drink. So I did my first year or two in recovery was fear driven. I was terrified that I was going to drink, so I did everything, and it worked for me. I've
Yeah.
got to say, and I can reflect now and go, I wish I hadn't been so frightened, but I was, and that fear kept me sober. But then I got to a point where I thought, I'm going to take a dip into this pool and see how it feels. Going back into work was one of those things.
Right.
Going back into professional and saying, do I feel able to function properly? I'm going to try it. And then
Did you go back as a nurse or did you
I
go
went
back
back
and
initially as a
retrain?
nurse. Yeah, I
You
went
did,
back and
right.
started as a nurse in a big rehab. So I was doing the detoxing.
Yeah.
And then I became a nurse therapist. So I started my counsellor training and became a nurse therapist. So
Yeah.
I had a foot in each camp then. But then I said, no, I don't want the nursing anymore. I want to focus on this.
So
And it's
you
been,
requalified.
yeah. And over the years, it's been about changing little things and developing. I've always thought you can't stay the same. You can't, even Delaney's only 3 years old. It's changing all the time. You know, you're
Yeah.
moving, it's fluid. And that's how it should be. This person's come in presenting with this. What do we think she needs? What do we think he needs? No,
Exactly.
right,
Yeah.
get on step one, step two, step three. That it doesn't work. You've got to say, right, what do you need? And sitting down with them and saying, what happened? How can we help?
And when did the equine come in? When was that when did that emerge in the practice? And tell me about that. I mean,
Almost 20 years ago now,
was
yeah.
it? Yeah.
I was involved in opening a place called Steps in Gloucestershire, and the owner's wife, Sam Quinlan. You know Sam Quinlan.
Oh, yeah, I do. Yeah,
Yeah,
she's
yeah.
over in the States at the moment, I think.
That's it, yeah. So
Yeah.
Sam Quinlan was the owner's wife, and she had seen 28 Days with Sandra Bullock and said, I want horses. And we were like, what do we know about horses? And we found a Scottish couple who had worked in America,
Yeah.
who worked for an organisation called Egala, and they came down to Steps and trained us. And that was the first training I did in equine, and we were the first place to do it in the UK, and that changed addiction treatment for me, having to, trauma for a start. Nobody was even then talking about trauma.
No, that's
We
right.
were seeing it coming up in the fields all the time. We were seeing horses going to people with trauma and this reaction happening. So we got right. I mean, we ended up with a database of over 500 people that had come in for treatment who had done 8 sessions of equine each. So we had all this.
So what happens with the horses then? Tell me about it.
Horses are prey animals, so they're hardwired for safety and for danger. So that's why they're flighty and responsive. So if a human goes in, Horses get traumatized as well because animals try to kill them or they fight with each other. So they kind of have a bit of a fight and a scream, and then they walk away and they shake their whole body and snort and start eating grass again. They release it physically with their whole body. We don't do that. So
That's
when I
Levine, isn't it? Wrote about that.
Peter
Levine.
Levine, yeah, absolutely. He studied it and noticed that animals that were traumatized, some of them lie on the ground and shake for a few minutes, so it gets all the chemicals out the muscles and shakes it all out, so you don't have that residual stuff we carry about.
Yeah.
Human beings, when the horses met them, we didn't know at first why they were doing that, but the horses were curious because they could feel this energy. Horses are like magnets and they feel emotion. So they would go up to the most traumatized person, often put their head into their chest.
Wow.
And so the man usually would start crying at that moment. It would just be the release. Soldiers with PTSD bang on every time. And it means the horse stands there and almost absorbs it. And then when it's finished, the horse kind of looks and walks away, and it does the same thing, shakes its own trauma out, but it's releasing the stuff it's absorbed. And then the human goes, oh my God, that feels different. Yeah, I've not got that feeling anymore.
And then the therapist can work with the patient
absolutely
at that point because they're no longer in that activated state.
Yeah. And they often don't need, I mean, I've worked with one particular soldier who was completely traumatized. He had been in the Lebanon and all that kind of stuff, real PTSD, but treated as alcoholism. I think for 13 years he had been going in and out of military hospitals for alcoholism. One session of equine therapy, it took a while. It was a 90-minute, 2-hour session. He cried for 45 minutes of that with a horse there, not a movement. And I'm still in touch with him. That's maybe 10 years now. He's never had a flashback since. He's never had sleepless nights, and I still don't know what his trauma was because he didn't have to tell me. So it was kind of...
They processed it.
They processed it, yeah. And that's the fascinating thing.
Which is an interesting thing about trauma, and it's an interesting thing about modern psychological therapies because, again, I think we're sort of still haunted by this old analytic model that you have to spend 10 years sort of going through stuff, and you don't. With trauma, it can be instantaneous. Because of the corpus callosum and the movement from left to right hemisphere. Once you open up that process, it goes fast, you know, and you don't even need to know what it was. And that's especially true, I think, when it comes to intergenerational trauma, which is passed down the amygdala. You will never know what it was.
No.
But that doesn't mean you can't process it because of the way it's presenting within the person. It's the presentation that's uncomfortable, not the event. That's the thing that people need to understand about trauma. Is that trauma isn't an event, it's your response.
It's what happened as a result of the event.
And so if you can change that response, the trauma's stopped. But I think there is an issue, like it's in the media, and it may be also in our field, where people over-traumatize. Everything's trauma, you know, and it's not. And we call events trauma, and they're not. It's the trauma is our inability to process something. And once we can process it, it's not trauma. It's just... It might be an unpleasant memory. It might not be any memory at all, you know.
I like Peter Levine talks about having a relational home, and that's, to me, what you're talking about. So I think the horse becomes a relational home. A group of people can become a relational home. Your family can be... Because there's also some research about several people having the same trauma, and the people that had a relational home to take it to didn't get PTSD, but the other ones did. Because it stayed with them. They had nowhere to go with it.
I remember one of the Army general. It was a really interesting guy thinking about this, and he was being interviewed on Radio 4 on some program, and maybe whatever. And the interviewer said, had obviously done research and felt very clever with himself. Said, but you know, we know the predisposing factors towards developing PTSD. Why don't you just screen those people out and not give them jobs as soldiers? If we did that, we wouldn't have an army.
Exactly. exactly.
Do you know what I
Yeah.
mean? And it's again that normalization of this thing. It's not the fact of it; it's our response that's
Yeah.
important.
Yeah.
And the problem with trauma in our veterans is not that they have trauma; it's just that we don't help them properly.
Yeah. Absolutely.
That's the
Absolutely.
disaster here,
Yeah.
and that's a public policy issue.
Yeah.
And
Yeah.
that's that's nothing more than that. We know how to do it, but we just don't invest in it, and that's the
Yeah.
crime. You know.
I went to a conference once, and there was a lady from Israel who was sharing on equine, and the Israeli government had made it compulsory for soldiers coming out of their subscription to have equine therapy before they went
That's
back
it.
into service, and that was it.
That's it.
She said there's no PTSD in Israel. They're all getting all the help before they go back out.
That's the way to do it, isn't it?
Yeah.
Just to say, right, this is what you're going to do. Get on with it,
Yeah.
and then you reduce the incidents hugely,
Yeah.
don't you? Thanks for that explanation. That's really helpful because people don't get it. There's also, I don't know if you've done surf therapy as well. There are similar, quite a magical results I've seen with soldiers
Oh, yeah.
using
And
surfing, and that's around Van der Kolk's
yeah.
issues around balance and stuff like that,
Right.
using back brain and balance
Yeah.
therapy and all the physical interventions.
Yeah. I've got a friend in Isle of Wight, Dr. Kim Brown, as well, and she does wolf medicine, and she works with soldiers coming out as well. She does kind of a bit like they go camping, a
Yeah,
bit like, what did they used to call it, where they had to,
wilderness stuff.
yeah, that kind of stuff. But
Yeah.
she's brought in this wolf stuff because I think they've even been to a place and went and met the wolves and things,
Yeah.
because she believes the whole animal human connection is so healing.
Yeah, it is. Well, we know
Yeah.
it is. I mean, it's a
Yeah.
very inbuilt thing into the biophilic
Yeah.
impact. That explains that. And then the next step for you, you've set up these various projects, but now latterly you're an author as well. So tell me, I mean, I think you're just bonkers to go into writing. It's such hard work. I don't understand. I mean, haven't you had enough punishment in life?
Do you know what? I mean, you know already. I got COVID in the first wave. I was stranded in Barbados. So when I got home,
I remember that on Facebook and staying in touch with you.
3 months I was
you had
there.
those neighbours, didn't you? That were so kind to you, that let
Fantastic,
you stay there, brought you food, took care of you.
It was really lovely. It was.
Yeah, they really.
And I got back after 3 months. I got back, and we were in lockdown here, so I couldn't work. So I was at home thinking I need to do something, and I just thought I'd started a biography 10 years ago, and I sent it to a few publishers, got nothing. So I thought, how can I do this differently? So I got my old bits of paper and I had them on drives, and I thought, how can I do this differently? So I decided to start from rehab. So the book starts just before I go into rehab.
Yeah.
And then it's flashbacks from my rehab. So it's kind of current and historical, and it meant I could choose the things that were entertaining and the things that were traumatic. I could select it rather than a timeline where you need to share everything.
Yeah.
So I got it to a kind of place I was happy with, and I sent it to 5 publishers thinking we'll see, and I got 4 offers.
No.
So I was shocked. I was shocked.
I'm not. It's a fascinating story. So
well, I signed up with one and agreed, signed off, and then I thought, what do I do now? And I thought, I wonder if I've got a story in me. So I started to write a novel, and that was the most fascinating thing for me. It's about mental health in the old hospital system. Yeah. When I was a CPN, there was lots of women who didn't have anything wrong with them, really. They were old, they had been in hospital all their life, but they were classed as moral defectives, was on some of their case notes, and they had got pregnant as young girls. So I thought about some of these. There were 2 in particular that I was really fond of, and I thought I'll create a backstory. So I kind of backtracked from there and created this story going right back to 1925 in East London, and then took it right forward, and then brought in all these other aspects of mental health system at that time, staff that were bullying and aggressive and violent, all that kind of stuff.
Yeah.
And it's like on Amazon, it's got mainly 5-star reviews. I'm quite proud of that because it's a story and it came out of me and I made it up. Do you know what I mean? It's like, and the responses. I did a couple of launches and I did a few library signings and things like that, and it's just went down so well that I've never had a negative thing really
Fantastic. What are the
about it.
books called?
The biography is called Behind the Smile, that
Yeah,
one,
yeah. It's a
and
nice smile you've got there, Mike.
yeah, it cost a few bob, that smile, and then and the other one's the story's called Mabel Murphy,
Yeah. You
saying
know, I
all
met Mabel's in my time. We both have, and
yeah,
it's true. It's real. This is what used to happen in these hospitals, where people were bunged in there because society decided that they were immoral
yeah,
and need to be locked away.
yeah.
You
I
know.
was a bad girl. One of them used to say to me,
Yeah.
I go, why? How long have you been in here? We go, since I was 15. I
Mm.
was a bad girl, and that was it. Or another one used to come up every day and say, have you heard from my son yet? You know what I mean? Like she was still waiting,
Yeah.
believing that she was going to meet him. So that's one of the
Epic
nice.
stuff. Yeah.
I've been able to do some nice things in Mabel Murphy as well.
Yeah, it's really important to get those stories out,
Yeah,
and because I mean I'm naive, but I think the more we tell these stories, the less likely as we repeat it,
absolutely. Yeah, yeah.
and I think that's really important. It's absolutely vital. So look, how can people get hold of you? What are the projects you're working on at the moment? Where's your website, etc.? So give me the rundown of
Um,
what Mike Delaney does in terms of products and services.
I've got a mixture now. I've got an office in central Glasgow, so on Hope Street in Glasgow, just next to the central station. So face-to-face clients I see there. I do a lot of Zoom. My website's mikedelaneytherapy.com, so you can book direct through the website if you want
Yeah,
to have any sessions. I'm still doing bits of equine. I'm involved with a company called Equiscotia, which I co-founded, but I've stepped back and I just do some consultancy and training work for them.
yeah.
Um, and I'm writing. I'm starting to write something else now. So my books are available on Amazon and everywhere else. You know, but
And are the links to buy the books on your website as
yeah,
well?
yeah, there are.
Right. So the website, say it again.
It's mikedelaneytherapy.com.
Right. So that would be the main point to go to. And I
Yeah,
guess you're on social media as well.
social media, Facebook, Mike Delaney 60, I think, on Facebook. Um, Instagram, they're all linked. Instagram, Twitter,
They're all on your
Threads now.
website, so people
Yeah,
can
they're
follow
on the
you and then
website as
catch
well.
up with
Yeah,
what we're
yeah.
doing. It's been an absolute pleasure for me to catch up with you.
Me too, Noel. Always
Feels like
nice.
feels like a long time since I've had a chinwag with you. You're one of the people that I can have a chinwag about certain types of
Yeah,
experiences from
yeah,
those days in hospitals and stuff like
yeah,
that.
yeah,
The changes that have taken place.
yeah,
And it's still very healing for me to be able to talk about that stuff because I
yeah,
was one of those people traumatized by those experiences,
yeah,
without a doubt. I remember going home in floods of tears on a regular
yeah,
basis because I
yeah,
couldn't,
yeah,
and just drinking on it. You know,
yeah.
that's what we did. Um,
That was a done thing.
yeah, yeah, particularly up in Old Reekie, I'm telling you.
Oh, I know, I
one,
know,
one
I
or
know.
two pints went down there. So look, that's wonderful to catch up with him. Glad to see that you're doing well. I encourage people to go to Mike's website. We're going to have to leave it there for now, folks, and then I'll catch up with you next time. And next time I'm up in Scotland, I'll give you a bell, Mike, and we'll
Yeah,
catch up.
do,
You
do.
take care, mate.
Thanks, Noel.